Good afternoon, everyone. Last night, a woman in her late 80s died as a result of complications of novel corona. She was a resident of Elgin County and was being cared for at the St. Thomas Elgin General Hospital at the time of her death. She acquired the infection through a close contact with someone who had recently traveled. The second resident of the building has since tested positive and is hospitalized. Southwestern Public Health is working closely with the property manager on infection prevention and control practices and educating the tenants about how to stay safe during this time. I extend my sincerest condolences to the family and loved ones of the woman who has died. Her death underscores the seriousness of the illness. Across the region, people are doing the right things. Now we need them to double our efforts. Ontario's Chief Medical Officer of Health has said that we should not leave our houses except to buy groceries and medications, walk our dogs, and attend healthcare appointments. I echo his words and strongly emphasize how important that is for people who are above 70 or who have pre-existing health care conditions or are immune compromised.
Thank you. We'll open this up for questions. First questions were submitted by Ian McCallum, MyFM. He asks, with today's death, it would appear the focus should now be on the community spread of COVID-19. Is this true?
So community spread is a term we use when the infection occurs in somebody who we can't connect to another case. So this one we do know was connected to a case that had traveled. So it doesn't really tell us that we have community transmission. That said, there is community transmission in other communities around us that they know for sure. So for our residents in our communities, I think we have to be cautious and behave as if there is community transmission locally.
He also asks, are tests being conducted at this time to a London lab for analysis, or are they still sent to Toronto, and what is the time lag presently for results?
So the lab in London is running now, and I understand that the St. Thomas Elgin General Hospital is able to send some of its tests to London. London has a priority list of swabs, with the highest priority ones having the shortest turnaround time. So London's approach is to take the more serious, the ones that are highest priority, and attempt to turn them around quickly. Swabs are also still being sent to the Public Health Lab of Ontario in Toronto, and their approach is to take all comers, and so they do prioritize some, but for that facility, the turnaround time may be longer. So the turnaround time can vary anywhere from 24 hours to several days, depending on the priority of the test result.
We also have questions from Kathleen Sailors, Woodstock Sentinel Review. She asks, in light of the area's first COVID-related death, what are the conditions of the other patients in hospital? Are they in critical condition or expected to recover?
There was one patient which was downgraded from the intensive care unit and is still in hospital, so that was good news. There are still patients in critical care there.
Okay. She also asks if there are any plans for an enforcement phone line for people to report neighbours or businesses that are not complying. For example, Haldimand Norfolk Health Unit launched one today and London launched one last week.
Locally, we are trying through multiple avenues to get the message out for people to abide by the direction themselves. We would much rather see cooperation with each individual person and each individual family taking responsibility for their part in controlling the transmission of COVID than to use bylaw officers or neighborhood information line. I'm hoping and asking that all our community citizens take on their personal responsibility for themselves and for their community and follow the direction of the Chief Medical Officer of Health to stay home unless specifically necessary.
We have questions from Rob at Elmer Express. Did the patient have underlying medical conditions that contributed to her death?
The patient was 80 years old, and age is an underlying condition. So this again is it shows us that our senior populations are more at risk just because of their age. As we age, our immune system gets a bit more tired and doesn't respond as well as it did when we were younger. So yes, this patient did have a comorbidity, that was age. There are other comorbidities such as diabetes, chronic lung disease, being on certain medications that suppressed your immune system, cancer, that can also be a risk factor. And those people as well need to be very attentive now. Now is the time to stay indoors and get someone else to run your errands for you.
Rob also asks if you could outline a timeline from the time she was believed to have contracted COVID-19 to when she began to display symptoms and sought medical help.
So COVID-19 symptoms, it can take a while for them to show up. We know that at the short end, it can be just a few days from the point in which you receive the virus in your system from another person to as long as 14 days. That's why we're asking people who have been at risk for exposure to the virus to stay home for the full 14 days.
Elmer Express, another editor from Elmer Express has asked, is mentioning patients are from Elgin giving enough information to anyone concerned about the concentration of cases? And would the health unit release more information about geography if there were concentrated areas?
I think the most important message for people to remember is that we are learning that you can spread the infection to another person 48 hours before you develop symptoms. We also know from other jurisdictions that we have community transmission, so that we know that there are people in communities that have the infection and that they may have it in them 48 hours before they even start to have a runny nose or a cough or a fever. And so I think for our citizens, the most important message is to be aware that anybody around you, even though they don't have symptoms, could possibly have the COVID infection. And so it's all the more important that we all really try and maintain physical distance from people around us, and that we try as much to stay home within our own little bubble.
Alvin Yu from CBC London asks, is Southwestern Public Health aware of any precautions the home has taken since finding out about this diagnosis?
So our staff is working carefully with the property manager at this apartment to inform the other residents about what has happened and to advise the facility on the infection prevention and control practices and educating the tenants about how to keep themselves as safe as they can during this period.
We have Paul from London Free Press who asks, can you say more about how the woman was exposed to the virus? Was it a close contact of a family member or caregiver?
So there were there was a couple who resided in that facility who had traveled to the USA and picked up the infection in the USA. And so the connection was that they were in this facility together. It does actually speak to the issue that those living in apartment buildings should try and reside within their own apartment, that it's probably best to close off communal areas in the apartment at this point in time, and that people ensure that before they leave their apartment, that they wash their hands thoroughly, and when they return to their apartment, that they wash their hands thoroughly, so that if they did touch any surfaces in a common area within their facility, that they wash those viruses off their hands.
He also asks, when was she admitted to hospital and when was she diagnosed? So the interval between.
I can't give you the specifics of the exact dates due to privacy. However, she was diagnosed promptly after admission.
We also have a question from Shane Rogers TV. He asks, is there any information about the timeline as to when the close contact was in relation to those symptoms showing up?
I won't go into the specific details of this particular patient. People are infectious at any time between, the first few days of contact and 14 days.
We also have Chris McMillan from Hard FM. Chris, do you have any questions you'd like to ask?
Dr. Locke, last time we talked, there was talk about a screening center happening at the Woodstock Hospital. Do you know what the latest is on that? Has that been approved?
It has been approved, in terms of the opening of that, I would refer you back to the Woodstock Hospital. They're the key decision maker on that.
We have Greg Colgan from Woodstock Sentinel Review. Greg, do you have any questions?
Yes. Hi, Dr. Locke.
Hi.
During her Sunday press conference, Dr. Tam was saying that this week will be really crucial in slowing the spread of COVID-19, and Dr. Williams out of Ontario said the same thing. Why is this week or the coming days so essential in slowing down that spread?
Well, we know that community transmission for some data in Toronto and other localities was beginning. We first picked it up about a week or so ago. We also know that for every one person infected, they can infect a few more people, and that it can take a week or two for the symptoms to show up. So we're concerned that for all those cases that received this infection in the community from someone they don't know, that they will all start to show symptoms now this week and in the next week. So anywhere from 5 to 14 days after they were in touch with someone else in their community. What he's really saying is we had the first circle of people who got the infection outside the country. Then we had the second circle of people who got it from someone in their community. And now we're going to get all that circle who got it from someone in their community is going to spread it to several more in their community. And we're going to pick up those pictures pretty soon. So if we were really good at staying indoors and not coming in contact with other people in our community, if people followed the recommendations, then our curve will be nice and flat. But if there was a lot of other transmission from those people in our community, then we'll see the curve rise up pretty quickly. So we're keeping a very close eye on what's happening to see whether or not we're having an impact from asking people to stay at home.